The healthcare needs of Brampton and Caledon have been ignored for too long. So we're having a healthcare and health equity town hall on Tuesday, November 21st to tell your stories. Our demands: additional public hospitals in Brampton with emergency rooms and overnight beds. Stop privatization of our public healthcare services, including surgeries, tests, and doctor's appointments. Implementing OHIP for all regardless of immigration status. We demand new public hospitals in Brampton with emergency rooms and overnight beds. Brampton and Caledon have a combined population of 827,500 people, according to StatsCan, and one fully functioning hospital with only 645 beds. It is considered by many to be the epicenter of hallway healthcare. Brampton and Caledon have very poor ratios of hospital beds to people, 0.78 beds per 1,000 people. You can see in this chart that with only 645 beds in Brampton Civic, covering a combined population of 827,500 people, we would need 2 more hospitals the size of Brampton Civic to get to the Ontario average, 3 more hospitals to get to the average of other Canadian provinces, and 5 more to get to the OECD countries average. This is unacceptable. Over 80% of all patients spend over 8 hours in Brampton's ER before being admitted. Brampton Civic Hospital and Peel Memorial Centre for Integrated Health and Wellness are both P3 public-private partnership facilities, with buildings and non-medical services not owned by Ontario, but by a private for-profit consortium called William Osler Health System, who has a 25-year contract to the government. The total cost of the Brampton P3 hospital is more than $300 million higher in present dollars from 2003 and 2004 than if the hospital was built publicly. This meant that Peel Memorial Centre could not be opened as a full-service hospital as is promised. Brampton City Council declared a state of health emergency in January 2020 and called for 850 new hospital beds to be created in the expansion of Peel Memorial Centre. There will only be 250 beds in the expansion. Brampton Civic treated 4,352 patients in hallways in a single year, according to a 2017 briefing note obtained by the provincial NDP. Brampton has high traffic and 750,000 people, plus residents of Caledon who already have to travel farther and therefore wait longer just to arrive. It's dangerous to have just one hospital to which to bring critical patients. According to the 2021 census, 80.6% of Bramptonians are a visible minority and 52.9% were born outside of Canada. The institutional neglect of the health of a majority immigrant, majority POC city by the Ontario government is very telling of how resources are being prioritized in Ontario. Follow to hear more facts about our other demands, stopping privatization and OHIP for all. We want you to tell your hashtag Brampton Health Stories and hashtag Caledon Health Stories. Reply to this video with yours. Brampton Caledon Health Coalition invites you to join us online or in person for a town hall meeting on healthcare and health equity, Tuesday, November 21st at 7 p.m. at Unifor Local 1285 at Bovaird and McLaughlin, 23 Regan Road in Brampton. The parking is in back. Doors open at 6:30 p.m. so you can meet us, our community partners, your fellow community members, and enjoy some free food and refreshments. You can also join us on Zoom. The link will be sent upon registration. You can register online at tinyurl.com/brchc town hall or using this QR code. Make your voice heard. Let's explore how we can create a healthier and more equitable future together. Join our team for our town hall meeting on healthcare and health equity. Go to the hashtag link in bio to volunteer, donate, or book an outreach table for your organization and add your logo here. Thank you to our community partners who will be joining us at the town hall.